You're listening to Abounding in Hope Talks, and I'm your host, Trisha Soderstrom. I'm a Christian homeschool mom who spent over 10 years healing from chronic Lyme disease and helping my family heal from chronic Lyme disease. Join me as I share from my experience and offer faith-based hope and practical tips for living out every day with hope as you trust in the Lord with your health, marriage, family, and homeschool. I know you'll be encouraged, so grab a cup of coffee or herbal tea and let's get started. Are you feeling discouraged and frustrated by the choice that you have to make regarding your children's education for the fall? Many states are not opening school until January, and that leaves parents trying to figure out what they're going to do. Now, if you're at all interested in homeschooling, I have 20 years of experience that I would like to share with you. I developed a new beta e-course called How to Homeschool, and I will answer your questions and walk you through the step-by-step process for how to get started. If you're interested, check out the show notes for the link. Hi, everyone. Thanks for joining me today for this episode of Abounding in Hope Talks. Today, I want to talk to you a little bit about Lyme disease and antibiotics. And to add on top of that, Babesia and Mepron or Coartem and Bartonella and the antibiotics that are required for that. So it's not just Lyme, but all tick-borne infections and the medications that are typically given by Lyme literate physicians. So I want to talk to you a little bit about this because I have mixed feelings about it, but I think that there are things that you should know about these medications and Lyme disease. And this is a topic that I wish that someone had discussed with me when I first got sick. Now, when I became ill in 2006 or 7, it took me 2 years to get a diagnosis, and by the time I was diagnosed, I was very, very, very ill. I was bedridden. I had lost a lot of my memories. I had come to the place of having neurological Lyme disease. And this infection and the co-infections that I had affected every single aspect of my body and my mind. And I was very sick and very scared, and I didn't know what to do. And I kind of fell into being treated with antibiotics because the doctor that I initially saw was within my primary care physician's practice. And she was basically treating Lyme disease patients. I mean, most of her patients, probably all of her patients, were Lyme disease patients. And I was able to see her and just pay a copay for the first 2 years of my treatment, which was a huge blessing, except that she only treated with antibiotics. And there were things that I didn't know would happen if I were treated with antibiotics. And I was too sick to figure it out. You know, I just kind of did what she told me because I didn't know any better and because I didn't have the brain capacity to research it and figure out, you know, was this a good thing or not? Now, pre-Lyme disease, I was not the type of person that would just go to a doctor for every little thing. In fact, I wouldn't even go to the doctor for the really big things. I didn't grow up going to doctors. My mom was more of a natural treatment type of a mom. And so that's how I became. I became the type of person that would rather treat naturally or just lay there and die instead of go get medication. So that's not really a good place to be. I've since learned how to have some balance, but you know, I just wasn't the type of person that would go get on antibiotics for things. Now, I did put my kids on antibiotics when they got strep throat, or they never, ever, ever had an ear infection. I mean, I had 4 kids and none of them ever had ear infections. But occasionally, a couple of my kids had recurring strep throat infections and they went on antibiotics. So I wasn't anti-antibiotics, but I was very cautious about when and how we used them. But here I was, super sick with Lyme disease. I couldn't walk. I couldn't think. I could barely stay awake. And now I'm taking 3 high doses of antibiotics at one time. And I was really upset about it. here I had prided myself on having good health and on taking care of myself and exercising. But now I was so sick, and my doctor's telling me I have to take these 3 different types of antibiotics. And she did thankfully tell me to take a probiotic, but probiotics are expensive, guys. And so I probably didn't buy the best probiotic to begin with. But I did take a probiotic. And just as a side note, okay, I'm not a doctor. I can't tell you what to do or diagnose you or treat you. But look into taking probiotics. Ask your doctor about them. But if you do take a probiotic and you're on antibiotics, don't take them at the same time. So you need to space them out about 2 hours apart, okay? And you want to make sure you're getting a really good probiotic. I have a list, I think on my website, of different supplements that I liked. But you can go on almost any Lyme website and find information about probiotics that work really well. So here I was taking 3 high doses of antibiotics, taking my probiotic, and what I didn't know when I would start taking antibiotics for Lyme disease was that I was going to feel worse. Now, you may be told that by your doctor, that you're going to feel worse. It's called a Herxheimer reaction. It's where the die-off in your body is too great for your body to handle. And then therefore you have all of these toxins floating around in your body and you feel horrible. And so you have to detox, take Epsom salt baths, use essential oils. I really liked using Berber and sarsaparilla combination, Berber Panella by Nutramedix. They have a great line of herbs, very high quality. And that combination in a little bit of herbal tea or juice was probably the most effective for me. And also taking the Epsom salt baths. Now, later, like many, many years later, I find out I've got the MTHFR thing and I don't detox well. And that made a lot of sense to me because I couldn't understand, why my husband would just do fine. But I felt like I was dying every time I had to change antibiotics or when I first went on antibiotics. I literally felt like I was dying. It just increased my symptoms and made them so severe. And it was just really hard. It was hard to function anyway, but then to go on these antibiotics and to feel that way, to feel even worse, it was really scary. So that was one problem with the antibiotics. And I had heard and I had read about Herxheimer's, but I didn't know that it would really be that bad. When I first went on one of the antibiotics, I can't remember if it was Doxy or Cefton, I felt very, very lightheaded and dizzy and woozy. I felt kind of like I wasn't really in my body, but kind of a part, not really a part of my body. It was just really strange. It was like a mental thing, but it was just really uncomfortable and kind of disconcerting. So over the course of 4.5 years, I took many different combinations of antibiotics. And I was also prescribed antifungal medication to help combat yeast, an antiparasitic medication for Babesia, which is a parasitic co-infection that you can commonly get with Lyme. Sometimes you can get that without getting Lyme. And I took different medications to help, I guess, beat down the Lyme infection. Well, I didn't know that having this many antibiotics in my system could cause so much damage. And I suffered from horrible digestive side effects. And even though I kept changing my probiotics and buying the best quality probiotics I could, I also took Florastor, which is Saccharomyces boulardii, which is a good yeast. And I took that to help prevent C. diff. I maintained a very strict diet. I eliminated gluten and dairy and all processed foods and all sugars, including fruit, until my potassium just plummeted and I had to start eating bananas and taking potassium supplements. So I was on a very, very strict diet. But despite that, these antibiotics destroyed my gut. They also caused inflammation of my liver. And despite the fact that I had learned about different herbs and different diets and things to do to kind of protect my liver, the antibiotic onslaught was just too much for me. It was too much for my body. So despite my best efforts to prevent side effects, as soon as I began taking antibiotics, like from the very beginning, I immediately started having negative side effects. I had bloating and gas and diarrhea and pain and horrible abdominal cramping. And after long-term use, I began having a burning feeling in my intestines. I had horrible acid reflux, yeast in my mouth, fungal infections in my ears. I began to have psoriasis and other skin rashes and stomach pain and vomiting. My symptoms caused pain so severe that I went to the emergency room more than once. And despite all the scans and the blood work and the tests, the emergency room doctors told me there was nothing wrong with me. They gave me morphine for the pain, which was very welcome because I had very severe pain. And then they sent me home to follow up with a gastrointestinal doctor. Now, you probably have experienced this, but when I went to the GI doctor and he looked at my labs, he told me that everything was fine. And so my symptoms were psychosomatic. Now, psychosomatic means that it's caused or aggravated by a mental factor, such as internal conflict or stress. That's the definition from New Oxford Dictionary. You know, I know that you can understand how much grief and anger that term can bring up in a person when they're suffering so horribly and their doctor tells them it's psychosomatic. And basically, it's really a reflection on that doctor not thinking outside of the box and just blaming it on a mental issue. To me, that's just pure laziness. But it was my third trip to the ER and my frustrating experience with an inconsiderate GI doctor that convinced me that antibiotics were not the answer for Lyme disease. Now, back then, all you ever heard from Lyme people on Lyme forums or from the books that you would read was that the antibiotics were the only answer. They were the only way to get people better. Now, there were doctors who were treating with Chinese herbs and homeopathy, but I knew nothing about that. That was like so way out of my comfort zone. And I never talked to anyone on any of the Lyme forums that were using these things that actually got better and stayed better. Sometimes they would start to feel better, but then they would relapse. Well, I was doing that on the antibiotics. And I should have looked into those types of therapies way back then and gotten off the antibiotics a lot sooner. Now, the thing about using antibiotics for Lyme disease is that it also acts as an anti-inflammatory. And so you can begin to feel better, but not actually be better. And then you start to go off of the antibiotics and bam, all your symptoms come back with a vengeance. And then you have to go back on them. And so that's what happened to me. Every time we would try to wean me off of the antibiotics, these symptoms would just come back with a vengeance. So eventually I did stop taking antibiotics. Like I said, it was 4.5 years. And once I stopped taking them, I had to work very, very hard to restore my gut. And I'm still doing that to this day. I began juicing. I continued to stay on a very strict diet. I continued using probiotics that I would rotate. I used bentonite clay. I used different types of therapies to help with my gut. Now, I never did the coffee enemas. I didn't even know about that until a few years ago. So when I was on antibiotics, I had not heard of those things. But I want to go back a little bit about the bentonite clay. If you do think about using that, please consult your physician first, especially if you have been on antibiotics for any length of time. The bentonite clay seemed to be very helpful for me, but later I did try to use diatomaceous earth, and that sent me to the ER. So just be really careful before you try anything. Talk to your doctor. Now, after 4.5 years of antibiotics, as you can imagine, my gut was so sensitive to everything, including supplements. And I had to be so careful what I ate, what I drank, what I took. And I just was really miserable. I couldn't enjoy food. And it was not fun. And I should have known, because when I first got Lyme, a friend of mine connected me with her friend, and her friend began to tell me how she had been on antibiotics and that was the only way to get better. But now she was dealing with issues where she wasn't digesting anything, and even her pills would be passed in whole form. And so I should have known, like it should have clicked with me that maybe antibiotics aren't the answer. Now, it takes a long time to heal your gut, especially if you've taken antibiotics for any length of time or any other harsh medications. And it takes a lot of hard work and diligence to get to a place where you feel somewhat normal again. And I had finally gotten to a place with my gut, and then we moved to a home which is on well water. And we had it tested and everything, and I believe that it was fine, but I started having gut problems again. And then I was exposed to mold, and of course that flared up my gut. So do you see what I'm saying? My gut was so sensitive and so inflamed that everything I came in contact with would set me off again. So I just want to really caution you, if you are taking antibiotics for Lyme, consider the long-term damage that it is doing to your gut. And even if you're taking a high-quality probiotic, that is not a cure for your gut. It is not going to completely protect your gut from the damage of the antibiotics. If you're on antibiotics for Lyme, or if your children are, it is critically important that you eliminate sugar and gluten and dairy. Any type of carbohydrates from your diet, you need to just eliminate them from your diet because they're food for the bad bacteria. And you need to make sure you're getting enough fiber and drinking plenty of water. Now, personally, if I had to go back in time, I would never have taken antibiotics for Lyme disease. And I absolutely would never have given them to my children. My 2 daughters who took high doses of antibiotics like I did are still struggling with their gut health. They both possibly have SIBO, which we're about to test for, and they both are having very severe issues with food. Now, my one daughter, who you got to meet on the podcast when we talked about PANS and Lyme, she was diagnosed with Crohn's disease and inflammatory bowel disease. And I believe that it was from all of the years of antibiotics. And she has suffered. She cannot eat what she wants. She, for a long time, from the time she was a young teenager, has had to be very careful what she eats. And it seems like the older she was getting, the worse her sensitivities were becoming. And so now she's been really focusing on gut health. 80% of your health is dependent upon your gut health. So you need to pay extra special attention to your gut health. And if you're filling it with antibiotics, there's really nothing you can do to completely protect your gut or your immune system. And I personally believe that the more you build up your gut, the more you heal your gut, the more you focus on inflammation in your body, the more that you focus on building your immune system, that the better your body will heal from Lyme disease. And that means using things like homeopathy and herbs to help to treat your symptoms. If you're even considering taking antibiotics for Lyme, I would just ask that you do more research and look into alternative ways for treating Lyme disease. I know that antibiotics can help some people, but I also know that even though they may recover somewhat from Lyme disease, they are left with devastating effects to their gut health. And so you may end up having to spend years and years repairing your gut and focusing on that aspect of your health. If I had to go back and do it all over again, I would start with herbs or homeopathy, and I would focus on using those things to help us to heal from Lyme disease, especially for my kids. It's just too difficult for children who are growing to be pumping their bodies full of that many antibiotics, and even the anti-malarial medication is very, very harsh on your liver. So do some research, talk to your doctor, Look into the different types of alternative therapies that there are. Nowadays, there are so many different options for healing Lyme disease. You're not stuck with just antibiotics. And quite frankly, the antibiotics can just really extend the length of treatment when it comes to healing from Lyme disease. So that's just my 2 cents worth. Like I said, I'm not a doctor. That's just my experience with myself and my husband and my kids. And so I just wanted to put that out there because I know a lot of people ask me, well, what would you do again? If you had to go back and do it again, would you treat with antibiotics or herbs or Chinese medicine, which I didn't really use Chinese medicine except for once for a gallbladder attack that I had. And it worked very well. But I mostly used homeopathy and herbs. So those are the things that really actually helped us to get better from chronic Lyme and other tick-borne infections. Okay, so as we end today, I want to leave you with Romans 15:13. I pray that the God of hope will fill you with all joy and peace as you trust in him, so that you may overflow with hope by the power of the Holy Spirit. Make sure you're subscribed to this podcast, and it would mean the world to me if you could share it out with your friends. Have a great week, and I'll see you next time on Abounding in Hope Talks.